Hi, I'm Dr. Miguel Vidal, a prosthodontist from Boston, and this is my expert tip. It's going to be regarding the abutment height selection. So once we've placed our implant and the implant is ready to be restored, we go ahead and take our implant level impression and send that to the laboratory. So we can then design the appropriate abutment and contours that we're trying to achieve. So the days of one abutment fits all or the stock abutments are really behind us, and we really need to focus on the patient's specific abutments and what they offer us and conversely our patients. So when we evaluate the tissue depth, that's going to be a critical factor in our design of our abutment and how much space we actually have available from the platform of the implant to the gingival margin process. So the more space we have, the better our outcome is going to be. And does the margin placement and the abutment height actually influence that? And there's several studies that do show that and conclusively show that the taller the distance is, 2 millimeters or more, the more likely you are to preserve your bone. And that's even with implants that have a platform switch design. Conversely, the closer you get to the platform of the implant and anything less than 2 millimeters, especially for implants that are non-platform switched, have conclusively shown that they exhibit bone loss in these areas. So what we want to do is really emphasize surgical implant positioning and having the right depth, not just for the emergence profile, but also for the positioning of our implant abutment height, our margin, and be able to access that area very predictably for cement retained restorations, and even with screw retained restorations to make sure if we're using a tie-based solution that cement interface is not located too far subgingival, because we know that can create issues with the soft tissue. So I hope this helps you in designing your next implant abutment crowns, and I thank you for your time.